Hello friends, today let us discuss about wounds and ulcers. There is a general misunderstanding that wounds and external ulcers cannot be treated through naturopathy. I can very well say that both the conditions can be attended by naturopathy and give very good results. If the wounds are simple, which do not need any surgical interference, those can be directly attended by applying naturopathy modalities. To avoid infection, always it is better to keep the body toxin free, for which fasting is the best way. Lankhanam paramaushadham. Fasting on water, coconut water or honey water helps avoiding the infection or preventing the infection. So that when one person is wounded, immediately we can start avoiding food and being on fasting for 1, 2 or 3 days. And during this fasting, we can attend the wound by exposing the wounded part to sunlight. Sunlight helps a lot in healing the wounds and external ulcers. Of course, it is the body that heals, but exposure to sunlight gives an additional help for easy cure. To provide a soothing atmosphere over the wounds and to avoid bleeding externally, we can apply some coconut oil or coconut milk or any such other natural products and expose to sunlight so that the wounds heal itself. Similarly, ulcers due to diabetes or cancer or different other accidents, there can be external ulcers. Such ulcers also, you can go for fasting and treat on the same lines like sunbath by applying coconut oil or coconut milk. I have come across a serious infection case after an accident where the bones of the arm, that is radius and ulna of the forearm and the humor bone of the upper arm broken due to the accident, and there was a serious injury also. Normally you can imagine the patient has to immediately be taken to some major hospitals where surgical help can be given. But in this case, even the surgeons denied to make a surgical intervention other than amputation at the middle of the upper arm. But the patient was not agreeing to that remedy. She has visited 3 different hospitals in few months' time. And in these 3 hospitals, they have tried with a temporary plaster and then permanent plaster, but it got severely infected. And finally, from the 3rd hospital, she took discharge and came to naturopathy. Normally, we say accident cases cannot be attended by naturopathy. And when there is severe wound and infection, a lot of pus formation, and at a stage where even worms used to come out of the plaster, we cannot attend through naturopathy. But the patient did not agree for that. Patient wanted to be under the care of naturopathy, and then our universal remedy, paramaushadham, lankhanam or fasting was started. With 1 week's fasting, the worms disappeared or stopped coming out, and after 2nd week, the heavy foul smell, which was making other patients to live in other 13 rooms of our hospital, had stopped, and after 3 weeks of fasting, we found that fasting need not be continued, and the patient was shifted to uncooked food, that is fresh fruits and vegetables, salads, sprouts, dry fruits and nuts, coconut. All these were served to the patient, and the patient improved drastically. And after 3 months of treatment continuous in the hospital, patient was taken to another hospital where the plaster was removed, and we got back the arm with a clear wound without any pus or infection, with an open wound. Thereafter we started applying coconut oil, coconut milk, and exposing to sunlight, and the wound was healed. And the patient survived with her arm for more than 45 years. So to say that wounds and external ulcers or infectious conditions also can be treated through naturopathic methods. Now I have a humble word to present to you, that if you are a diabetic patient having any ulcers or gangrene, that is partial death of extremities like hands and feet to begin with, if you develop such a condition, do not hesitate to approach to a naturopathy doctor or a hospital, naturopathy hospital, so that you can be greatly helped by the naturopathic intervention. Of course, for diabetes you may be on drugs, different medicines you may be following. That need not be stopped in conditions where we can show that the sugar level is within the normal limits. Even we can stop the medicines and treat the wound or the gangrene condition. In gangrenes also, it's not that we heal the gangrene, but we stop the gangrene extending further. I have seen many patients, part by part, is being removed, whereas you can arrest such complications or growth of gangrene or wounds or ulcers by resorting to naturopathic method. And it is very simple lifestyle modification with a proper diet with the fresh fruits and vegetables, sprouts, dry fruits and nuts and coconuts, and a minimal use of carbohydrate diet, non-spicy and non-fried, and then taking sun bath, breathing exercises, yogic relaxation programs and meditation, and also some treatments with the water like hydrotherapy applications, mud therapy, acupuncture and acupressure where it is indicated, body massage where it is indicated, and some hot and cold applications, packs and compresses, mud packs. With this, we can treat external wounds, ulcers, gangrene conditions, diabetic ulcers, or ulcers of cancer. We are not asking to completely stop the medicines if you are on medicines, but if you prefer, we can try that also. But otherwise, by continuing the medicines also, we can treat this kind of conditions.
Through yoga and nature treatments, cure for many diseases have been practiced by Dr. Babu Joseph. For his service and guidance, visit Kakanad Netaji Yoga Naturopathy Hospital. For more details, call 9567 377 377 or send a message through WhatsApp.